Hey everyone, and welcome. We have a special presentation. Today we have Dr. Chris Eric, who is a dean, assistant dean at National, with like, in my mind, the top chiropractic school in the country. And he's going to talk about something we haven't really discussed a whole lot, which is research studies and how clinicians can participate in research studies and how this can be a really great benefit for you and your patients and your practice and the profession in general. So he and I are going to have a little discussion back and forth, and
Yeah.
he's quite an expert in this area. And I'm going to introduce you to Dr. Eric.
All right. Thank you, Dan. Dr. Kalish, I really appreciate this time to speak to the doctors, the clinicians, the practitioners out there. Maybe there's some students on here that are also interested in writing and preparing case studies for publication. I was just talking with Dan about some of the purpose and some of the reasons why we write and publish these case studies and case series also. I wanted to, like Dan did, I wanted to put up kind of a plug for my university. I love my university of National University of Health Sciences. Like he said, I'm assistant dean of chiropractic medicine at the university, but also we have naturopathic medicine, acupuncture, oriental medicine there also. So we kind of really have an integrative care and integrative style at the university. And you guys are always welcome to contact me at the university or otherwise. Like Dan said, and I'll let him kind of interject as much or as he wants to, but we're here to kind of talk about the value of doing case studies and case series. And probably, maybe some of you have done some research, you've done some literature, you've done some publications, you've done some writing in your career. I've found that not a lot of clinicians and doctors have actually done a lot of writing and actually published an article, but it's so powerful for the doctor, for the clinician, and also for your practice to do that. And I think a lot of times doctors think it's a overcoming pile of work to do, that we can't actually do it, the whole process of doing a publication, but it's really, really not. And so I put up, just as kind of a backdrop here, my case study that I did some time ago. I'll make it a little bit smaller here. But I just want to go through kind of the definition and purpose of a case study. Obviously, a case study is one or two patients, and it's really there to document what has happened during the patient encounter. A case series is three or more patients. A lot of times we like to see more of a case series, especially if you are treating a certain type of person, a certain type of condition. If you see a diagnosis come through your office so many times and your assessment, your diagnosis seems to be right on, if your treatment seems to be very effective, or if you have a case that just seems to be very, very rare that we just want to document also, that's one of the things, or several of the things, that we want to do a case study or a case series on. There's a couple of types of case studies. I'll just say case studies for the time being. There's a retrospective case studies. So this is the one that I wrote. It's a management of a patient with chronic fatigue. The title, I didn't want to put chiropractic management of a patient with chronic fatigue. She actually had Hashimoto's thyroiditis, but we'll get through some of the process of submission and changing things in that peer review process. But I had to change the title of that. But this is a good example of a retrospective case study. I had this patient, I had all of the data, I had the content, I looked back and I wrote it up. And so I think that's probably the most popular, common kind of case study. And again, very easy to write up if we have the data, if we have the documentation. We can also do what's called a prospective case study. And I was just talking to Dan about this and the possibilities of doing this, especially if we are planning a certain type of treatment, if we're planning a certain type of assessment, either for you or with a series of doctors and clinicians, that would be kind of a higher level of case study or case series to do. And what that is you would plan out what you're going to measure, what your management is going to be. It would all be the same kind of management and evaluation of the patient. And it's a little bit closer to a clinical trial, although with a clinical trial, you are actually going out and recruiting these patients. For a prospective case study or case series, you're actually waiting for these patients to come in. And another big difference is that uh, we do want to go and get approval from an ethics board or what's called an institutional review board before we actually do this case study or case series. And so that's kind of the difference in actual the two. Um, Obviously, there's benefits. We talked about the benefits of putting some of these case studies and case series together. My focus, as you can probably see from this case study, is really, like Dan Kalish said, functional medicine. I used a lot of the same tests and evaluations and supplements that Dan used here in my case study. And that's one of the big passions that I have is obviously in our offices, in our patients and facilities, we know that our treatments work, but there's just not a lot of that reflective in the literature. And so my passion is to get clinicians and doctors together and get that information together and have them actually produce, write up, and publish these case studies, because what happens is these case studies will actually build to be clinical trials. As we see more and more of these case studies build upon each other with different kinds of conditions, different kinds of patients, young and old, there's going to be clinical trials that are formed with that see the number of case studies actually increase. And obviously there's benefits to you. I'll try and state some of those at the end also. Dan and I will talk about those just to help your practice to increase the number of patients that you see, the high quality of patients that you see, and to kind of go forth from there. And so that's my other passion, is to help doctors and clinicians to build their practice to not only increase their clinics, but also to help to promote their own career too, and not only to within their clinic, but also to be seen as an expert. If we're seeing a lot of different conditions or dysfunctions in your clinic, this is something that we really have to document and describe. And so,
Yes, in a way, Chris, in a way, it's to me the most powerful marketing tool on the planet. Because it disassociates. It's not self-serving. It's science-based. It's validated by a larger community, and yet it's all about you and what you actually did. You know what I mean? So when I did my first big study was with the Mayo Clinic. I had a small group of Mayo Clinic doctors that took my training program about 7-8 years ago, and we put together it was a pretty big study, 25 people, and it was a big deal because it was Mayo Clinic. It was a year of work, and I wouldn't recommend doing a whole year of your full-time work for something like this. But I think the way it was so appealing to me about what you're doing is that these single one-off case studies are not, I mean, it's maybe a month of evenings, right? Or we're talking about 20 to 60 hours of work, not thousands of hours, right? This is
right.
maybe even, it's a totally doable thing. And when I think about the legitimacy it gives you to be published, and the other avenues of publishing, which we were talking about earlier also, which is writing a book, which is, again, a year-long project. This is something you could do really in a month or two that you can learn from personally and develop professionally that helps your patients. And, again, is just a wonderful business and marketing tool. It's so much better than what we used to have in the old days when I first started my clinic, which was a testimonial book in the waiting room, right? Which is like little kind of handbook, like a hand done thing where patients would scribble their testimonials. because it takes that to the level of scientific validation just because you're writing it up, and it's work that we're doing anyways, right? So it's not a lot of extra work in that way. The other thing that was profound for me when I did the study with Mayo was that, like you said, we kind of know that what we do works, but when do you really sit back and spend a weekend thinking about it and analyzing it and looking at it? And when I saw how well the protocols worked in that study, I was actually really surprised. Like 8 out of the 9 H. pylorys were cleared, and all these adrenal panels got better. And so for me, it just sort of also on a personal level validated this work that I'd been doing that I kind of thought was effective, and I intuitively knew was effective, but actually to see that measured um, gave me an even higher level of confidence to pursue the work that I do. So it was enriching in that way as well.
Yeah, I mean, one thing that I always remember in publishing and is especially if you're doing it on an individual basis, and especially if you know that this work is true, that you know that there's a lot of evidence uh, in your own clinic, in your own office, but also with other doctors that are just like you. Uh, when you do a publication, it's set in stone. It's really there forever, and it is really yours. And especially you mentioned kind of a review book or a testimonial book. We all know that we have patients that have improved in a similar fashion. And so it would just be imperative to put together a case series or a case study of at least one or two patients to do this, and then hand it out to either the patients or other practitioners that may refer to you, or other organizations too that have insight on it, and just looking for someone that treats uh, conditions like this or symptoms like this or dysfunction like this. So one of the questions that I get a lot is documentation. How important is documentation in case reports and case studies? And I've come to the conclusion that obviously it is important, but also it's not so important. And let me explain why this is. Obviously, our documentation with our patients should be as good as we can have it, especially with the flow and the protocols that we have within our clinic. But also, if we look back into our notes and our documentation doesn't have as much content as it really should be, it shouldn't really stop us from doing a case study or case series. It, it, we're going to have some limitations in our case study, but as much information as we have, it's going to be enough. And the kind of the reverse thing about it is, and we talked about this, that a case study is usually between 1,000 words and 2,000 words. And so the problem that we have with case studies usually is keeping it within the limits of the journal. And so you'll find with all of our documentation, a lot of times we'll have too much documentation, even though there's going to be limits of that documentation. It's always important to kind of self-reflect upon our documentation. Now, the flip side of that is also, if we are going to do kind of a prospective case study or case series, we do need to do some research on what kind of patient outcomes do we want to look at? Do we want to look at just the ones that we've been using in our office, or do we want to look at other, both objective measures other than the tests that we use in our office, or do we also want to use maybe some subjective surveys also that are
Yeah, that's really important.
part of that?
Is there like a resource that you have where clinicians can, or some list that you have of what are potential questionnaires or additional information that they could use if they're going to think ahead?
There is, and I can't think of it just now. There's actually a database, and I can't think of it. It's funny that you bring that up, but yeah, there's actually a database that you can search different conditions, different diagnoses, and even different symptoms, and it will bring up, the top 1, 2, or 3 surveys that are actually used in research with that, and you can actually use it in your clinical practice. But I'll make sure that I get that and send that to you, Dan, because that's just a
Great.
wonderful research to have it, especially if we're planning a prospective case study, or if we want to maybe incorporate it in our practice for future retrospective case studies that we have. So. And so, one thing that I guess I would say to clinicians is kind of self-reflect on what kind of outcomes we want to measure, what kind of documentation do we have in our office and that we're doing on a daily basis. And don't forget about the subjective documentation too. We just mentioned the surveys, but also what are the patient's own words too. And a lot of times in case studies, if we see the patient's own words actually change from day 1 to day 15 to day 45 into 3 months, that is actually a better outcome than any other objective outcome sometimes that we can use. And so don't forget about the patient's own words if we could. And again, plus we need to be concise with this. We need to actually shrink down some of the documentation that we actually have. We don't need to include some of the vitals that we maybe do every time. If we do heart rate, temperature, blood pressure, we don't need to use that stuff if it's not pertinent to the case study. And so one of the things that we do that I help doctors do is actually evaluate what's the pertinent documentation that we do with the case study. And so let me go down in my case study that I wrote some years ago, and you can see if we're familiar with Dr. Kalish, cortisol and time of day and the levels of cortisol, that one measured this, but also some of the, I think I have a table here. No, I don't. You can see some of the pertinent outcomes that we did, including some of the levels of cortisol. TSH was very pertinent because that actually decreased significantly. Vitamin D, this patient's weight, we documented, obviously DHEA was almost normalized with this patient. And so one of the things that we want to do to help the reader kind of be concise and not read too much and be bored with this case study is to just put in the kind of the pertinent data that we would have in a case study. So it really has to be concise. Another thing that we have to think about, especially if and I'm hoping that we have some ideas of case studies and case series to actually write up, and Dan was correct about these things don't take a year to write up. These things, may take, if we're doing it the right way, they may take a month or two to write up, and then we have kind of the review study. But to really have a good case study, it's not going to take as long as, obviously writing a book or things of that nature. But one of the things that we really have to think about is who is our audience when we talk and when we write about case studies. And that really depends on the journal that we publish in also. Are we going to publish in kind of a general journal, general health professions, health science professions journal, or are we really going to publish in a specific professional discipline journal? So for example, my counterpart, George Stretch over here, is the Assistant Dean of Acupuncture Oriental Medicine. He's had lots of case studies go through his office, but a lot of his colleagues and also his students will choose to publish in an Oriental Medicine and Acupuncture journal. And that, if they're doing a case study possibly like this, they're going to rewrite it in a way that people that have a background in Oriental medicine acupuncture will actually understand. If that publication does not go through and we want to go to another general publication, well, we may have to rewrite a few parts of the case study. So it's part of the planning process that we have to pick out who our audience is, but also what our choice of journal is. And not all journals will actually publish case studies. The number of journals that are actually publishing case studies are actually decreasing, but there are some core journals out there that are publishing sometimes only case studies, or making that a good percentage of their articles each month that they publish. So
And how hard is it to get a journal? Do you find that most well-written case studies end up getting published? Is it usually doable?
uh, I do. I think it is easy. Well, one, obviously, to submit and get it accepted. I think we should prepare ourselves for sometimes either a minor edit of the article or sometimes a major edit of the article. Now, I say major edit, it doesn't mean that we have to write it all over again, but we may need to add a couple of paragraphs, or change, switch around some content within the article. But that's one of the things that I want to say out there, is not only writing the article is not as difficult, but also publishing the article is not as difficult, I believe, as people think too. Because a lot of times I think we're sometimes, if we're not familiar with research or publishing in a journal, a lot of times we're afraid of being rejected, and I just don't see a lot of that out there. And I probably, on your first, second, or third time, I probably wouldn't try and submit and publish in a very high level medical journal. But if we have kind of a professional organization based journal, a lot of times those journals are really trying to attract not only academics to publish in their journals, but they're really trying to attract clinician and private doctors to publish in their journals too. I know several editors of journals, and they're just thirsty for real clinician written case studies and case series, because they know that that is what builds upon clinical trials, systematic reviews, meta-analyses, maybe literature reviews. Even though it's seen to be the lowest quality, not quality, but lowest amount of evidence in research, it is really the foundation of everything above that. And so if we stop submitting and publishing case studies, we're really taking the foundation of that higher level of research that we really do. And so that's why I really want outside clinicians and private doctors to actually, start feeling comfortable writing these case studies and case reports. And so, and like we said, writing it may not take that much time. Sometimes it will be accepted just like that. Sometimes the editors will want to keep it for a certain month of publication. Sometimes when we get the article back, there will be, and I would say most of the time, there'll be a list of comments that the peer reviewer will recommend changing. We don't need to change everything that the reviewer wants us to change. We would, give reason why we don't want to change it, and that's going to be fine. The editor will have kind of the final say-so for that. There may be a few references that we need to look up. Why did we use ascorbate for this patient? Why did we use DHEA on this patient? What are maybe some background references that we can use for that? And so there's a little bit of patience, I would say, going through that peer feedback and commentary kind of part of submitting and publishing case studies, but it really is worth it 1,000%, 1,000 times over, to have this publication in your hand and to use it for yourself, for your practice. A lot of times we could submit the abstract to maybe a presentation, and now we're networking in kind of another realm, and then we can advertise that to to our locale, to our patients, and to other organizations around us, that we are building our expertise, and not only as a doctor, but also our expertise in the things that we teach about functional medicine and the treatments that we do, and the kind of protocols that we use here in the Institute. So it is well worth it to do that.
Yeah, that is well, and then I'll bet. Well, the doctors I've talked to that do these on a regular basis get into it and crank out several a year often too. I think once you get used to the format and how easy it is, it's not that big a deal, right?
It isn't. It isn't that big of a deal. There are, and it's just written just like a regular, article that you would write maybe, while you're in school. There's obviously introduction where a lot of the literature review is actually done. And then we have the section of case report we see down here. Let me go to the bottom here. Case report really is just documentation of the patient. What's the background of this patient? What's the some of the what they present with, and then what was our assessment of the patient, and how did we actually manage this patient, and then also the case report includes the results. And obviously I put some of the results here after the presentation, the evaluation, the background of the patient, our management of the patient after testing. What are the results of the patient after we manage this patient? So it's really very organized article. And then kind of the magic of a case study is the discussion section. In no part of the case study do we ever give our opinion about the patient or the condition or the introduction of the case study or the purpose of the case study until we actually get to the discussion. And this is really where the magic happens, where we can really put our opinion on, this is actually how I helped the patient. And so we can be a little bit opinionated a little bit in this case study. We can kind of put our own kind of flavor within the case study. With case studies, you really can't say, this caused this, but we can give a little bit of hints in that discussion section, and kind of explain the dysfunction and how we actually eased some of that dysfunction by our management and kind of the future of that. And so that's kind of my goal in doing case studies and trying to make it easier for doctors and clinicians, is just to put it together like a puzzle, week by week or whatever time period by time period. Let's do the introduction that includes the purpose of this case study. Then let's do the second half of the case, or the introduction, which is the literature review of the case study, which is really not that much. And then let's go to the meat of it, which we're talking about every aspect of the patient. And so maybe 1 week we can do the presentation and then the background of the patient. And then we can do how we evaluated the patient, what was the testing of the patient, what pertinent outcomes do we want to keep, what pertinent outcomes do we want to kind of throw away because they're not really important. And then also, what was the response of the patient? What was the results of the patient? Still within that case report section of the case study. So that's really the results of that section. And then, splitting up the discussion into 3 or 4 parts, again, taking a few days each part in writing that out. A great book out there, I'm not sure if anyone has really heard of it, but it's called The Slight Edge. And it's really taught me to really cut things into pieces and pieces to accomplish the whole. And so that book, The Slight Edge, really talks about, making it into puzzle pieces versus doing this whole, 2,000 word case study all at once. And so it really is easier than we really think it would be. And then conclusion is usually a one paragraph kind of synopsis summary of the case study, which is, again, very easy to do. But yeah, that's really my goal into helping doctors and clinicians actually do case studies, and showing them kind of the benefits of that, and really having some good examples of clinicians actually benefiting really well about writing case studies.
Yeah, well, that's exciting. I guess, the more I think about it, the more you can, plus if you have something that you focus on in your practice, like autoimmunity or
Hmm.
thyroid issues or fatigue or adrenals or whatever it may be,
Hmm.
you can kind of customize your case studies to emphasize the things that you know you're good at, right? So that when it
Hmm.
comes to using it as a patient education tool and kind of a way to establish better professional identity and credentials, you have something that's really backing up what you're doing, right? So that when you
Hmm.
attract a new patient, you can say, well, I did publish this case study. You can take a look at this. It's very similar to what you're going through. And
Hmm.
it seems to elevate the whole discussion to a different level to me.
we I think we all, like, I practiced, obviously I'm assistant dean, so I'm academia now, but I help students to get to, obviously, to the point that they can practice. But even from trimester one, I want them to specialize. I say, if you want to do a general practice, obviously do a general practice, and that is great. But my hope is the majority of you will specialize, if in chiropractic medicine, if that's going to be spine specialty, if it's going to be functional medicine, if it's going to be sports medicine. I want you to do whatever your specific passion is. I really think that case studies and case reports will help and enable individuals to actually specialize a lot more, and a lot faster, if we could, because you're really helping yourself pick the kind of patients that you really want. And if you're treating patients that are, it's really easy, but you're not really excited about the condition. But someone, like you said, comes in with an autoimmune inflammatory disease, and you know exactly what to do, and it really excites you. And even if it's kind of difficult to manage, you want to see more of these patients. And I think part of that passion is to write a case report. And just with that, we're going to see more and more of these specific patients that require evaluation, that require a deeper evaluation of functional medicine, their hormones, inflammatory markers, deeper markers that we all test. That's just gonna make our practice more exciting, and it's gonna help us be seen as an expert in our field and in our locale also.
Yeah.
Yeah.
Let's see. And then do you have any other general advice? We can post these resources later
Hmm.
too about how to poke around and find journals that would be interested in publishing in
Hmm.
the various areas that people are in.
Right. I can give you a list of journals that actively have that accept case studies and case series, um, and make that available. I'll make a document of that. I already told you I'll make I'll send find that excuse me database on the surveys that people can
Yeah.
incorporate in their practice, so that if they want to change some things about their practice or add that to maybe do a future case study, they can do that. um, but also, if they have a journal in mind, and maybe they've worked with them before, or they know the editor, or they know people from there, probably the best thing, it's kind of boring to say this, probably the best thing to do is to go on that journal's website and look at the author information, the instructions to the author, and it will list the things that you really have to do to publish a case study, a journal article there. It can be kind of kind of a difficult thing to read and to kind of capture in your brain. It's like, can I really do all of this that they're asking me to do with, the parameters of writing and the word limit and the style that they're asking you to do? And so I'm always here to help. Also, they can always contact me. But that would be kind of the first steps. And uh, with this, I'll give all the resources that I have to drive them in the right direction to which journal that they want to possibly publish in or submit in, or if they have any questions, they can always contact me.
Yeah, that is, I really appreciate that support because I think it's
Mhm.
when it's, well, like I said, once the first one of these, I think for all of us would be challenging. Once you've done one or two, um, it all of a sudden would probably be a really straightforward process. But there's a big
Mhm.
initial hurdle to getting it started. But I think it's so
It is.
worthwhile to put the energy into this kind of thing. And like you were saying, it's a month or two of work, right? This is not a
Mhm.
long-term commitment to scientific study. And the thing that blows my mind is the flexibility because you could do a case on mitochondria, you could do a fertility case, you could do a toenail fungus case, right? You're not limited by like some kind of double-blind placebo-controlled
No.
body thing. Right? This is just like you and your practice and representing that, right?
Right. I mean, you don't have to, with the exception of probably a prospective case study or case series, you don't have to wait on an ethics board to approve your study. You already have it. And so the only thing that's really limiting you is, putting pen to paper or your fingers on the keyboard and just hashing it out, but also doing it in kind of an organized manner. And it's not really limited to case studies and case series also, to put your name out there, to help yourself in your career, to be an expert in your field. We can also work on doing, literature reviews. We can also do maybe some systematic reviews also. Those don't need any kind of approval from IRBs also, or ethics boards. They're a little bit longer to write, but still gives you a lot of notoriety in there, and especially if no one is actually writing about this. There's so many things that people don't write about in research or in literature reviews or systematic reviews. It just, especially in functional medicine, it is just so needed in that field.
Yeah, it's true. There's very little of this being done.
Hmm.
I think Cleveland Clinic just got published in JAMA recently, right? Did you see
Hmm.
that?
Yeah. Cleveland Clinic is just, in conventional medicine and in functional medicine, they are really starting to combine both of those. And I think that's what we really have to keep in mind too, is, obviously, we are experts in functional medicine, but also we need to keep mind and knowledge about some of the conventional medicine and how that works and doesn't work, and how we talk about the opioid crisis, how we can actually decrease the use of the medications by functional medicine too.
Yeah,
Yeah.
it's an exciting time, and I feel like, the more that I get out and I travel quite a bit and go to conferences and things that are directly related to functional medicine, other things that are just, industry, in general industries that we're touching on, and that we're we're just coming into this inflection point, I think, where in the next 3 to 5 years, functional medicine is really going to start to take a place in the broader community of the world, not just
Hmm.
limited to those who are very interested in integrative and alternative medicine as it has been. I think when I go to, just like, for example, traveling to New York recently, talking to one of the prominent guys at CNN who's on TV all the time. He's like, functional what? He never even heard of the
Hmm.
term. And so you get people who are really sophisticated in the most enlightened city in the world who are on top of the media as no other, and yet they haven't even heard the term yet. And I think that explosion is going to start to happen in 3 to 5 years. So if the doctors that are listening to these kind of talks start to position themselves and become an expert in an area and publish a few of these, you know, 3 to 5 years from now, these kinds of things can get you on, a TV interview, or, get you to really be able to promote your practice and your business in a way that you become an expert in a burgeoning field, right? And it's a
Hmm.
wild, wild west right now. I think people can stake their claim on any of these things, and if you have the bandwidth to write a book, that is obviously a good thing too. But I think two or three case studies under your belt can get you pretty far, right? In terms of, just being an expert in a given area.
Yeah, I think so. And especially if you, not only if you are in a, a single doctor office, obviously it's going to promote you, but if you have other independent contractor or associate doctors in your office too, having them do the same is just going to explode your practice too.
Yeah.
And especially if they're not doing exactly what you're doing, if maybe they're complementing your functional medicine and they're doing physical medicine, and somehow in the case study you can actually combine the two and how they're synergistic, that's just golden right there. And that's exactly not only promoting your practice and promoting the doctors of the practice, but from an academic um, view, it's really what we need in research and in the literature when it comes to what we would call integrative medicine. And so anything to promote functional medicine, integrative medicine, and also the professions that serve those disciplines is would be obviously optimal too.
And could you tell us a little bit about your website too? And I know you
Sure.
have some projects going where you're trying to facilitate the ease of this for practitioners.
Hmm. So I do have, I'm formulating, like I said before, I'm formulating educational modules to put together some of the pieces easily for clinicians to do this. And I have a website, it's called Impact Factor, IMPAXFACTOR.com. And again, we're formulating these educational modules. Feel free to go to impactsfactor.com and put in your name and email, and then the kind of the first day that we have educational modules, we will send out that information, well before the introduction of those modules. If you're part of this seminar and this list, obviously I'm going to give you a good discount on this. I'm huge friends of Dan Kalish and their staff and everything, so I want to help people who, not only are passionate about functional medicine, but they're also students of functional medicine too. And so please, if you have any questions, please just go to impactsfactor.com. It's really a community also. I'm going to have blog and resources and obviously journal, uh, uh, research, case study, case series, literature review, library on just how to do some of these things. And not only how to do it, but do it very effectively and do it in a manner that's really going to promote you personally, professionally, but also the practice that you're in. So that's my shameless plug for my venture here and my passion. So.
Yeah, no, I think this can really break things open for people because I'm sure there's a lot of people that really want to do this, but they
Mhm.
just need a push and they need someone to honestly just hold their hand through the process, right?
Mhm.
And if you're willing to help people do that, I think that's huge. The other thing that occurs to me too is that one of the big factors that's very negative about functional medicine is oftentimes people are in solo practice and they're very socially isolated and they don't have a lot of colleagues. It's not like you're working in a hospital and you run into all the other doctors in the cafeteria or whatever, or just walking down the hall, right? We're oftentimes very isolated, and I think that the case study idea is a way to talk doctor to doctor about
Mhm.
functional medicine and what's working in a given practice. And I think that that's a whole nother, like you're mentioning, community, a whole nother level of community where you could
Absolutely.
really impact other doctors that you may or may not ever meet that will see your work and be excited by it and be encouraged to do other things than they wouldn't know about otherwise, right?
Yeah, and I'm really designing it as I would in the university here with active learning, but also with peer feedback, also giving examples of different sections of the case study or case series as kind of examples of what to write or what not to write, so they can kind of not mimic it, but reflect the content of that and reflect the quality. So it's really the way to go. And I'm keep on telling the students here is, if you just study on your own, if you are just, trying to get it all on your own, then you're really not going to benefit as much as if you go with, in cohorts, or if you're not getting peer feedback, and that feedback is kind of an open mindset feedback. That's really the way to go versus just trying to go on your own, and then you'll get discouraged once you get the feedback back, or just plain encouragement is really the way to go.
Yeah. And then what is the website? Is it because David Elliott just texted me. He's having a little trouble getting Impact Factor to come up. Impact, like you have it though, impactfactor.com, but it
Impact
won't
Factor.
come up on my thing either. I'm not sure why. That's weird.
Okay, I'll
Maybe I have
look
to do
into that.
www. Well, it's a new venture anyways, but let's see.
It is. I will look into that and make sure that I'll look into see what.
Yeah, you have to do the
maybe.
www first.
Okay.
So you can change that though, Chris, on your end. Like, so David, if you do www.impactsfactor, it'll pop up. But there's a way, David. There's a way, Chris, you can shortcut that. I don't know exactly, but you're
Okay.
the guy that do that. Yeah.
I'll look at the admin. Yeah.
Yeah.
I apologize.
Oh, no problem. This is exciting, and
Yeah.
we'll definitely want to have you back later on, and we try to get a few of the people at the Chaos Institute to run a couple of these. And so, anyone listening to this, if you're interested, please reach out to me, and Chris and I can help support you in your endeavor. Would love to get 5 or 10 of these done in 2020 with a bunch of different docs. So if you're curious or interested, please contact the office, and I think we have a pretty good support team here to help make this happen.
Absolutely.
Yeah, and thanks again, Chris. And we definitely want to have you back. If we can get a few of these done, maybe the next time we can be looking at them.
Absolutely, we can showcase these case studies, and just really show the success of it getting published, and how they're being observed in the scientific literature, but also what's happening in their practice, and how is it really affecting their practice afterwards. So those are kind of the 3 things that we want to look at.
That's great.
Yep.
All right. Well, thanks again for your time. Appreciate it.
All right. Thank you. Thanks, Dan. Thanks everyone for listening in.
All right. We'll talk again soon.
All right. Thank you.
Bye now.